I want to get the other big story of the day, and it seemingly really came out of nowhere. President Trump saying that he's been taking hydroxychloroquine.
I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
When?
Right now, yeah.
Yeah, when?
A couple of weeks ago, I started taking it because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right. I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it. Excuse me. A lot of doctors take it. I take it. Now, I hope to not be able to take it soon because, I hope they come up with some answer. But I think people should be allowed to.
So the president has spent weeks pushing the anti-malaria drug as a potential cure for COVID-19 against the cautionary advice of many of his administration's top medical professionals. So does this make medical sense?
Yes. Listen, people have got to separate politics from the practice of medicine. Everything he said was absolutely accurate. It has been around for 40 years. It's been prescribed hundreds of millions of times for malaria. I personally have prescribed it hundreds of times for malaria, hundreds of times for rheumatic diseases. I've never seen one adverse side effect. I can't say that of Tylenol. I can't say that of aspirin. Now, every medication has risk. That's just the way it is. But in a otherwise healthy person with maybe a rheumatic condition or to prevent malaria, it's a very safe medication. Do not confuse it with chloroquine. That's different than hydroxychloroquine.
Okay, so
different medicine.
So the FDA put out a warning about both hydroxychloroquine and chloroquine.
No.
They said this warning in April that it can cause a dangerous abnormality in heart rhythm in virus patients. Said about both of them, and that only in hospitals should it be used and in clinical trials. This is not being used in a hospital and not being used as a clinical trial.
Correct. That's the FDA standard. Doctors are entitled to do anything they want with a medication. They take on a certain degree of liability. They do when they do that, different than when something is FDA approved. We use off-label medication all the time. Some of our more common prescribing is off-label, not FDA approved. Now, this is for not a hospital setting, not a COVID setting. It's being used for prophylaxis. Doctors take it themselves for prophylaxis. They prescribe it for patients for prophylaxis.
But the FDA says that there's no evidence that works.
No, because that study's not been done yet. They're talking about the treatment of COVID.
No,
in the treatment of COVID.
Preventatively, there's no study that shows that works. The president is doing this to prevent, unless he's had coronavirus,
that is correct.
And he's lying about it.
Doctors can prescribe it prophylactically. I know many doctors are doing it. I know many doctors that are taking it themselves, because there's some evidence that it might be prophylactic, and it is so safe. So they feel like rather than do nothing, they'd rather do the chloroquine, hydroxychloroquine, not the chloroquine, which does have cardiac side effects. The studies on hydroxychloroquine and the cardiac effects have yet to be washed out. They observed a couple of cardiac events, which are common in COVID patients. Whether it was related to hydroxychloroquine or not is not the issue. The issue is, in the setting of acute COVID-19, there is not good evidence to use it. It does not seem to make a difference really one way or the other. The professional guidance is probably better not to use it. For prophylaxis, school is still out. Doctors are prescribing it all over the place. And if I were taking care of the President of the United States, I would feel very comfortable prescribing it.
Well, of course, he is constantly monitored in terms of his health. Some of these other patients who may start to take it on their own don't have that.
On their own, the doctor has to prescribe it. Like I said, I prescribed it literally hundreds of patient years, not one side effect. The only thing we would have people do is see an ophthalmologist once a year because there were retinal and corneal effects, but no one ever got them.
Well, I've worked with doctors, and if you look at the one survey, the only bad survey, they were giving it to people that were in very bad shape. They were very old, almost dead. It was a Trump enemy statement. Now, if you look at some of the reports that came out from Italy, that came out from France, that came out from a lot of our frontline workers take it because it possibly, and I think it does, but people are going to have to make up their own mind. Plus, it doesn't hurt people. It's been out on the market for 60 or 65 years for malaria, lupus, and other things. I think it gives you an additional level of safety, but you can ask, many doctors are in favor of it. Many frontline workers won't go there unless they have the hydroxy. And so, again, this is an individual decision to make, but it's had a great reputation, and if it was somebody else... other than me. People would say, gee, isn't that smart? But we are working on a lot of other things. We have, I'll tell you what, the great medical companies that we have, if you look at what they're doing therapeutically, cure-wise, and the vaccine itself, and the vaccine, I think, is less important than some of the things they're working on. They're working on a cure, and we have more than one doing it, and very advanced. They're working on therapeutics, and they're working on vaccines.